Hey everyone, my name is Stephanie Strauss, and I am the current Education Division Director with ASHT. And the Student Outreach Committee is happy to be bringing you the Student Series vlog, where we're going to be discussing the personal experiences of the student, Chloe, and what she's going to be experiencing with her fieldwork rotation over the next 12 weeks. This is Chloe Lantz, and she's from Elizabethtown College in Elizabethtown, PA. And we're going to hear her experiences over the next couple weeks of her ins and outs and what to expect in a hand clinic and as a clinical hand student. So I'm going to be asking her some questions. It's going to be very casual. And just to kind of get an input, what we're looking to do is to reach out to any of those students out there who may be interested in doing a fieldwork rotation or in hand therapy, or are currently doing a rotation in hand therapy, and just to hear some other experiences of other students, and to let you know that you're not alone and you're probably all experiencing the same thing. So the first question, why did you select, or why did you want to do a clinical rotation in hand therapy?
So I guess I can start off by saying I really was enjoying doing orthotics and orthoses in school. So I kind of really like that aspect. And then my grandpa he currently is missing his left hand. He had an injury and he lost his left hand. So like growing up, I always was really intrigued with how he could do everything one-handed and how he learned to like use those skills and gain strength in his non-dominant hand. So I kind of started like looking into hand therapy a little bit more because I was like, oh, I really like how specialized it is, and I like the figuring out the inner workings of everything. So I kind of started to look into that and found that hand therapy was kind of what I wanted to look into.
And just by looking at how you're going through the anatomy, this is definitely a place for you.
Yeah.
You seem to like the anatomy part. Did you do anything in preparation? As to prior to coming to this site, this is your first week, and we just finished that up. And ahead of time, what did you do?
So I did have like a phone interview with Steph, so we kind of just touched base on like what the expectations were, just knowing that hand therapy is going to be a little bit more intensive, just because of the anatomy and that kind of aspect. But then I also just kind of touched up on my anatomy. Obviously, I haven't taken anatomy since sophomore or second year of college, so it's been a little while. So I kind of touched up on the hand anatomy, upper extremity, utilize YouTube and textbooks, and kind of just looked over that stuff.
So what were you the most concerned about starting this level 2 rotation in hand therapy?
This is my first level 2 rotation, so I was a little worried, just because I haven't had that clinical experience prior, and since this is more specialized, I was kind of worried about not having all of that knowledge from school. Like we are generalists based, so it's not like I knew all of what I was going into. So I feel like that was something that I was a little bit worried about. And then I was worried about like remembering all of the anatomy, like the deep parts of it, because I mean obviously now we've kind of touched about a little bit about how we know basics but we don't know all of it. But I was worried about remembering all of that and putting that into practice.
Well, one good thing is that you don't have to have everything perfectly memorized, especially for your clinical rotation, because you're going to be learning more.
Right.
And even once you're out in the clinic practicing, unless you're doing it every single day, I mean, I know my anatomy, but there are sometimes, maybe I might get a shoulder, I might have to go back and look something up, or look something up in the brachial plexus, because I don't use that every day. So that's one good thing. Just remember, you don't have to know everything perfectly to start your rotation. Now, we haven't really had the opportunity to do any evaluations yet this week. We're going to be starting that next week. So what other things this week have kind of stuck out for you? Whether it's related to, the care that we provided, or just how you're feeling in the clinic itself.
I would say at first, like I was kind of, obviously, as any student, you're nervous going into your first day. You don't know really what to expect. You're kind of worried about that. But then I feel like we kind of hit the ground running. We kind of were going right in with patients, and I feel like that was really helpful because I got to see how Steph interacted with her patients. And it was like, they were having casual conversation, and I could slowly like build up to joining into those conversations, which helped me feel more, I guess, at ease.
Mhm.
And then also like I was just observing a lot and getting to see scar massage and all those types of things, and just observing that and kind of connecting it with the things that I've seen at school, but also like then seeing how it's put into practice really helped. And then we also Steph made a orthosis for someone, and I thought that was really intriguing to watch because we've made certain things like that, but not to the extent that she did. So that was pretty cool to
So
watch.
we made a static progressive PIP extension orthosis, and I did it pretty quickly, so I didn't have a lot of time to explain to her as we were going, but was able to explain afterwards. But typically some of those orthoses they can take more than an hour and 15, 20 minutes to make. So we had to do that in like 30. So
You're
it
like a
went
wizard.
pretty quick. But what would you say you the takeaway from this first week? So I know you came in with a lot of anxiety, kind of nervousness, fear, which any student is that first day you're walking through the door. What would you say your recommendations or suggestions are to anybody out there looking to do the hand therapy rotation or going through it now?
I would say that you're going to be nervous. I mean, it's kind of fact of life, but it's not something that you need to be incredibly nervous about because it's something that your instructor will help walk you through, and they're not going to just like throw you into it and make you eval someone right off the start. You're going to watch and you're going to understand their process a little bit more, because I feel like once you start to see that process a couple times, it starts to be like, oh, okay, well, that's what you would do. And you can kind of walk those steps through in your head while you're watching them. So I feel like you don't have to be so worried about the first day. Like, you're not going to get thrown into the fire pretty much. So I feel like you just have to take it one step at a time and, come in prepared, but you don't have to know everything. You don't have to think that you need to know everything. They're going to walk you through it, and just be open with them and share what you know and what you don't know and ask questions.
Yeah, it's really one important thing is just to communicate. If you don't know something, just say, hey, I'm not sure I understand that. Can you give me any references? Is there any suggestions that I can go home and look things up that evening, just to come in the next day learning a little bit more? Your goal is to absorb and be a sponge and soak up as much as you can. You're not there to work. So I know a lot of locations may say, oh, we have somebody else to like do the job now, but just remember you're there to learn, and you want to soak up everything you can. Any final closing comments?
No, I feel like it's been a good first week, and I'm excited to keep learning more.
Good. So next week, you're going to hear all about Chloe's experiences doing her evaluation and some of the objective testing, and then any other things that may happen, because things happen and pop up out of nowhere. So expect the unexpected. But I hope this helped, and thanks so much for joining us.